Hey everybody, Greg Schmades here in the New Mexico Senate. Just wanted to give a brief update into what happened today in New Mexico. Something very unfortunate. Our governor has decided that, and we've known this for some time, but to violate the bodily integrity of our teachers, our healthcare workforce, by mandating vaccination. And so I just want to give you my thoughts on that. First, I'd like to start with our teachers in our schools. She misses the science here. We have a robust experience now worldwide for how schools, what's going on in schools with COVID transmission. And I want to be clear on something. So the evidence from millions and millions of people across Europe, namely UK and Sweden, show that COVID is not spread in schools. Now, what does that mean? Does it mean that it's impossible to contract COVID in a school? No, that's not what that means. We're talking about a public health scale spread of COVID. Who is contributing to that spread? That has not been shown to happen in schools. In fact, in the UK, in a study of 10 million people, okay, this is great news. It actually shows that being around children regularly and living with children, it actually was associated with a decreased risk in dying from COVID. Nobody in the States seems to talk about that, and I don't think the governor has seen any of that data. If she has, she's ignoring it. And so is it safe? Is it safe to go to school right now? Yes, it is. Do we need to be mandating our teachers, a lot of whom, which, by the way, are women of childbearing age? And so we've already heard from a hospital here in New Mexico that they have a substantial healthcare workforce that are women that are either pregnant or are of childbearing age and considering becoming pregnant soon. What does that mean? Well, some people are saying that it's safe for pregnant women to get the vaccine, but they don't have a religious exemption. They just feel like they want to wait, and they have concerns. I think that's a reasonable concern. We should not be judging people right now based on how they feel about something that's new and something that's once again part of their bodily integrity. That's a major problem. So she gets the science wrong on schools. We don't need to be doing this sort of thing in schools right now. It doesn't make children safer. It doesn't make parents safer. It does not make teachers safer. All it does is it's going to cut into our workforce, and that's going to be a problem. So lastly, on the vaccine mandate, here's my big concern. We have tons and tons and tons of healthcare workers in New Mexico that, for whatever reason, they are choosing not to get the vaccine. And what's going to happen? What's going to happen when we have so many people that I've already heard from, by the way? I've heard from 3 hospitals across the state already that they're not going to be able to work and they're not going to get the vaccine. So what happens when you get in a car wreck? What happens when your child has an asthma attack and needs to go to the hospital? And what's only worse than a bed shortage, I think, currently in New Mexico is a doctor shortage and a nursing shortage and a healthcare worker shortage. Very, very dangerous for New Mexico. And this is not working together.